And I believe also, Madam Deputy Speaker, that this is an administration that has been seeking to inspire hope in our people, whether it be through our our very ambitious housing program, whether it be through all of the allowances and policies and programs that we put in place for our young people, whether it is the Job Start, whether it is the various initiatives in the Ministry of Youth and Sports. We have sought to bring hope to our people. And from 2018 through our manifesto, which contained within it many of our promises to the people of Barbados, we introduced the concept of the establishment of a facility for palliative care in our island. So I'm happy to be here today to be able to lend my voice and support to what I believe philosophically is centered on people, demonstrates the compassion of our administration, and is here to establish and give our people some hope. There are many reasons, Madam Deputy Speaker, why a person may need end-of-life care, palliative care being an aspect of that. We spoke, of course, of the Barbados Association of Cancer Advocacy and their work to help us to come to this point, identifying location, working with the Ministry of Housing, working with the government by extension, to be able to envision and now bring life to that vision for this facility that is due to come. But outside of cancer, there are many other reasons why a person may need end-of-life care. And I believe that this type of a facility is really a game changer in that regard. You would have heard, Madam Deputy Speaker, the Honourable Deputy Prime Minister would have said that the Queen Elizabeth Hospital does a pretty good job of trying to create a space where persons who are facing death, first facing a terminal illness, it creates a space where acute care can be rendered to them. But of course, in a limited hospital or tertiary care institution, you would always have a challenge in terms of the delivery of that care. So whilst the QH is trying its best to ensure that acute illness is being dealt with and service delivery is not compromised, we welcome the opportunity for an expansion of the bed space through these 14 beds that will be available at this institution. It will definitely relieve some of the pressure and the strain that is on the Queen Elizabeth Hospital, because at the end of the day, we have seen from our numbers, from our metrics, that it costs a lot more to take care of a person, especially when we think of the elderly who are at the hospital. It costs significantly more within the QH environment to care for those individuals than it does within many of our private institutions and those that exist outside of the government's remit. So when we talk of palliative care, of course, we're looking to ease the symptoms associated with a terminal or incurable disease or illness, a medical condition that is causing a person to have, in many cases, significant pain. And there is a need for that support during that time, not only for the individual who is facing the condition, but also the support is necessary for those who are there as family, friends, and other supporters while that person is facing that phase of life. Madam Deputy Speaker, as I said, there's so many different reasons why a person may reach that stage where they're facing a terminal condition. We must focus just for a moment on NCDs and the burden that it is causing our country. Non-communicable diseases, Madam Deputy Speaker, in my opinion, is probably one of the greatest threats to us being able to progress as a country, to develop as a country. When we look and we juxtapose that with the fact that it is said that by 2050, Madam Deputy Speaker, 1 out of every 2 persons in our country will be over the age of 65. We have not an aging society, but an aged society. So when we dovetail our significant NCD battle and the strain that it causes and it places upon our resources, our limited resources, and then we tie that to The fact that we have a population that is aging and aged, Madam Deputy Speaker, I believe that this becomes a cocktail of sorts that can be very dangerous to our development and to our progress as a small island developing state. It is said that 8 out of 10 persons or just over within our country die as a result of a non-communicable disease, Madam Deputy Speaker. 8 out of 10 persons die as a result of diabetes, hypertension, chronic respiratory illness, cancer, and the like. These are the top 4 NCDs that we see within our population. And Madam Deputy Speaker, every time I speak about NCDs, I have to underscore the point that these are largely preventable diseases. Largely preventable, meaning that you can avoid them as an individual, and as we as a people in this country can avoid these NCDs and the onslaught that they bring to bear on our population. 65%, Madam Deputy Speaker, of the Queen Elizabeth Hospital's budget goes towards NCD management, addressing NCDs. 65% of the money we allocate to the Queen Elizabeth Hospital on a yearly basis, 65%. 65%, Madam Deputy Speaker, goes towards dealing with NCDs in their various forms. And not only that, but 73% of the Barbados Drug Service, in its dispensation of medication to our population, 73% of it goes towards NCD management. And this just shows you and contextualizes for you how massive the NCD burden is as a country. Now, if we can reduce the numbers of persons, and as we focus on people and compassion and hope, if we can reduce the numbers of persons, as the Honourable Member for St. Michael South East would have said, the Honourable Deputy Prime Minister, if we can focus our people towards prevention, as opposed to the focus and heavy focus on cure, then I believe that we can see that 8 out of 10 coming down to less and less numbers over the next few years. It's not going to happen overnight. So we don't have any misgivings about that at all, because we're talking about a cultural change, things that have been ingrained in us. We like to eat certain things, we like to eat them certain ways. We like to prepare our meals through certain methods. And we know these things to be unhealthy, but it is how we do it. It's how we've always done it. So there's some cultural realities that we have to confront, some social realities, some economic realities, and what we can call all that the determinants of ill health, determinants of health. So social, economic, political even, environmental. There's so many. But we're spending a lot of money to manage NCDs in our country. And when we talk about NCDs, and I like to say this, it is not just what we're doing to face the NCDs when we are confronting them or when they're presented to us as healthcare professionals, but it's also what happens when there's a loss of productivity. It's not just that we're having to expend significant funds to fight NCDs, but we're also losing significant revenue. We're losing significant earnings. It is estimated, Madam Deputy Speaker, that $145 million is lost per year when we talk about productivity loss relative to NCDs. $145 million per year is the estimated cost of our lost productivity as a country, as a small island developing state that could ill afford to lose even $1 in productivity per year. When you're a small island developing state with very little natural resources, you can ill afford to lose money due to productivity loss. And when a person is confronting diabetes and it causes them to have to call in sick more times a year than they would like to, when a person is confronting cancer and they're not in the state of health or strength that they can come to work and they can give you 100%. These are the realities that we face when we're talking NCDs. Every one of those 8 out of 10 persons is a person. That is a mother, a father, an uncle, a niece, a nephew, a brother, a sister. Persons are dying in our country daily due to largely preventable conditions. And we have to do something about it. So whilst we're here talking about palliative care and, of course, end of life as persons transition from this earth, And we do so with people at the center. We do so with compassion. And we put this thing in place so we can give some of our people hope. We must also have a serious conversation with our people relative to the direction we're going as a country. We have to put the brakes on relative to NCDs in this country. Every person who is diagnosed with diabetes is now on a slippery slope of health and ill health, where they can be good today and they can be not so good tomorrow. And unfortunately, Madam Deputy Speaker, I must say here that even when persons face these conditions, and some face them with bravery and with a steely resilience, that they're able to say, you know what, I'm not going to let this condition get the better of me. I must say there are many of our people, my brothers and my sisters in this country, who oftentimes don't take the conditions as seriously as I would like them to take it. They're prescribed medication, they don't take the medication. Doctors or other persons tell them to change their lifestyle, they don't make the adoptions. And the adaptations, they don't adopt the policies or the suggestions and make the adaptations, I should say. So we need to take this very seriously, because had not for the grace of God, there go I. There go you, Madam Deputy Speaker. And we need to make sure that we are here as productive as we can as citizens of this beloved country of ours, making sure that Barbados does well. And it can only do well when each of us as individuals do well, health-wise, mentally, physically, and of course, from a productivity perspective. So what are we doing relative to NCDs and this, what I call and what I say within the ministry all the time, this battle against NCDs? Madam Deputy Speaker, we have introduced a national strategic plan relative to NCDs, covering the years 2023 to 2030. And within that strategic plan, we outline all of the steps, all of the objectives, all of the aims, and all of the programs that we will introduce. And some of them I will list off here today as well. Of course, Barbados, I'm always privileged to tell persons that there's not a huge problem with smoking in our country. Because when we do the research tells us that some of the determinants of ill health, some of the determinants of these very same NCDs, one of the major ones is tobacco use. And I'm always pleased to be able to share that in Barbados, I think we have had this pretty much under some tight control over the many years. And we've, as an administration, we have banned smoking in public places as well. All of this in an effort to ensure that we keep on reducing some of these determinants of ill health. We, of course, introduced, as many other countries, restricted age limits relative to the use of alcohol, so that we can control when our young people become exposed. And I must say here that it still concerns me that reports coming out of the various entities in the National Council of Substance Abuse, etc., is still reporting that we have young people below the age of 10 that are exposed to and consuming alcohol and other substances. Madam Deputy Speaker, I'm speaking to parents today. I'm speaking to neighbors today. I'm speaking to nieces and nephews and aunts and uncles and grandparents. Please watch and monitor what your children are consuming. Encourage them to stay away from these drugs. Stay away from these substances that will cause them a long life of pain and disadvantage. It will set them back. Madam Deputy Speaker, what else have we done? There is a tremendous focus, and the Honourable Deputy Prime Minister spoke of this, on community health. I've come into the ministry over just a year ago, and one of the first things that, from my sitting in on meetings and trying to obviously learn the portfolio and see what is going on, one of the first things that I realized is that the ministry has changed its strategic focus. The ministry is not focused just on the delivery of tertiary level care through our Queen Elizabeth Hospital, but there's a tremendous refocus of this ministry and strategic refocus on primary health care. Once again, staying true to the adage that an ounce of prevention is better than a pound of cure. And I believe that if we front load, if we put our money, if we put the dollars that are at our disposal as a government towards preventing illness, that would be a far better and more strategic option and choice and path to take than putting money behind chasing illness and curing disease. So this ministry right now is oriented to focus on primary health care. And that's why we are building out our polyclinics. And our polyclinics, you can get all the various, almost all of the services that you can get at the QEH, you can find within the annals of our various polyclinics across the island, all 9 of them. And there's a plan, Madam Deputy Speaker, to expand, and you've heard of this before, to expand our polyclinic network in the sense that we are restructuring all 9 of these institutions so that they're more purpose-built, fit for purpose, and they're more suitable for a 21st century population. So 7 out of those 9 polyclinics will have full renovations, and we're rebuilding 2 of them, Madam Deputy Speaker, full rebuilds. Because right now, as they stand, they are not purpose-built, they're not meeting the needs of our populations that they serve, and we need to ensure that we do it right as we go forward. So with the assistance of our partners, we are doing that full revamp, as you were, of our polyclinic networks. Madam Deputy Speaker, we are also focusing on nutrition. There's a big focus on nutrition. I'm responsible for nutrition, the National Nutrition Center, and I meet with the management team there on a regular basis, and we're always talking about how we can get nutrition information that is more palatable. Pardon the pun. But it's easier for persons to be able to assimilate the information, and you would have seen that there's been an increase in the amount of tips, nutritional tips that have been shared across the various social media platforms. Not only that, we're seeking to work with the Ministry of Youth and Sports to change our approach to how we deliver nutritional content and information and education to our young people. When I came into the ministry, we have this approach where we have this National Nutrition Summer Camp. And we have a handful of students that will come to that and participate in it on a yearly basis, Madam Deputy Speaker, and that is fine. Over the years, it has been a good resource. But I believe that more can be done and greater reach can be had if we work in conjunction with the national sports summer camps, where they have tens more children at their disposal. And we can work with them and collaborate with that ministry as a one government approach to health to share our nutrition information to our young minds as they're coming up. But let me move on, Madam Deputy Speaker. Another area that we're focusing on before we move on is we're asking our people to increase their levels of physical exercise. And even as we talk about palliative care, and we talk about all these different purpose-built developments and different things like that, one of the things I would love to see is that every single development that we have going forward, Honourable Minister of Housing, is that there's some element to it that's built around encouraging our people to be more physically active. So whether that be a walking track around the development, whether that be that how the roads are laid out and how they're structured, that they're able to accommodate persons being able to go in a circular way around their home, whatever it is, some little effort that would allow and encourage our people, whether they be old, whether they be young, to adopt more physically active lifestyles. Let me move on, Madam Deputy Speaker. It was recommended by some work that was done and some reports that were done that we have a standalone palliative care or hospice facility to supplement, of course, and expand our community palliative care here at the tertiary level. And coming out of that 2012 report, it was posited that over 60% of Barbadians could have benefited from hospice care. 60% of persons, this is a 2012 report, 60% of persons, it is said and argued, could have benefited from palliative care. And we therefore are, I think, in the right sphere when we are now offering to BACA the opportunity to have this facility that would allow us to expand our care so we can reduce that number of persons and ensure that of that 60% that would have benefited from it, that we can get a large percentage of them being taken care of. Madam Deputy Speaker, beyond the NCDs and the different changes that we're seeing relative to our aging and aged population, we must realize as well that we have some other demographic shifts. We have smaller families that we're dealing with. Madam Deputy Speaker, there was a saying when I was a child that it takes a village to raise a child. That village was made up of grandparents, aunts and uncles, sometimes people who were not even blood relatives, but they were close to the family friends, and all of those persons contributed to the rearing of individuals, rearing of families. That has changed. So we have smaller families. The extended family is different, where they don't play the same role. In many cases, the grandparents are still working, Madam Deputy Speaker. So even as there was a time where the grandparent would be home, and you can come and bring the children, and the grandma and the grandpa would happily embrace them and teach them the fundamentals of life and play that role of parenting, sadly, many of those grandparents today are still in the workforce, and they're not as accessible and available to our young people. And of course, we have an immigration issue where more of our young people now are traveling outside of Barbados to seek opportunities because there are opportunities that are available across the globe now. And the world has become a really small village, a global village. And if there's an opportunity that presents itself in some part of Timbuktu, some of our young people are embracing those opportunities. And that leaves them parents who are aging, and in many cases who will ail from time to time, to be here on their own. So there's no doubt, all of that just underscores the importance of this type of a facility in our country. We want to ensure, when we talk about people and compassion and hope, we want to ensure that through a facility like this and the expansion of the health services around it, a partnership between the Queen Elizabeth Hospital and, of course, BACA and other entities. Not only them, but there's so many other entities out there that are in the health space, NGOs, charities that are in the health space. And we are willing to work with all of them, and we work with many of them already through subventions and other programs. But we want to ensure that our people can die with dignity, that they can face death with dignity. Madam Deputy Speaker. So, as I begin to wind down, Madam Deputy Speaker, we want our people to be healthier. We want our people to embrace healthier lifestyles, because I believe that this will help us as a country ultimately, even as we wage this battle against NCDs. The Honourable Member for St. Michael's South East would have asked very directed and targeted questions relative to the linear accelerator. And Madam Deputy Speaker, I too, like the Honourable Member, am disheartened by the fact that we have not been able to deliver this as yet to the people of Barbados. Not for a lack of trying, not for a lack of effort. That does not offer any sympathy or any cause for persons to sympathize or empathize, but we are, as a ministry, and if I could dare speak for the Honourable Member in the other place, the Senior Minister of Health and Wellness, the Senior Minister responsible for health and wellness, he too would tell you, if he were standing here, that he would love for this facility to have already been delivered to the people of Barbados. Madam Deputy Speaker, the work continues relative to the establishment of the linear accelerator in our country. There's a lot of civil works that have been undertaken to be able to facilitate it. As you could imagine, any entity that has any radiation involved, there would have to be a special purpose-built facility and space for its housing. So therefore, some of these civil works have taken inordinately long. But the team at the Queen Elizabeth Hospital is working assiduously to ensure that we can get to the point where the civil works are completed. I have been told, Madam Deputy Speaker, that those civil works are due to be finished this week. And once those civil works are finished, the next stage in the process is for the team through whom we have received the linear accelerator, because it's already on island. The linear accelerator is already here. But until the space has been built out in the way that it should and the manner that it should be, we cannot set it in place and therefore commission it. So the team that we have worked with to help us to get to this point will be coming in during the course of July to help us to be able to establish the linear accelerator. I have been told, Madam Deputy Speaker, that that process will take about 2 to 3 weeks, with them being on the ground, helping us and our technical teams here to be able to not only establish, but to start testing and commissioning the linear accelerator during the course of the month of July. So therefore, I can give the Honourable House, I can give the Honourable Deputy Prime Minister, and of course all of those with whom for whom she speaks, because she's advocating on behalf of many people just like we are, those who are right now facing a cancer diagnosis. And I often tell people, Madam Deputy Speaker, as I wind down, I see you looking at me in a certain way. So I don't know if you're sending me a signal, but I'm going to wind down. There are many illnesses that people confront in life. Cancer is one that in many cases can lead to death. And persons take a psychological hit, an emotional, mental hit, when they hear a diagnosis of cancer. Somebody may prefer to hear, I gotta cut off your toe, or I gotta cut off your finger, before they hear that you have cancer. It is that serious of an announcement in persons' lives that it hits them not only physically, but it hits them psychologically and emotionally as well. It is not an easy, I can't imagine it for myself, and I know that those who are facing it is not easy for them to face. So we will do all that we can as a ministry, the Ministry of Health and Wellness, as a government, to ensure that we continue to drive forward the various facilities, the various equipment, the various expansions that are necessary to our Queen Elizabeth Hospital, to our polyclinic network, to various policies that we're going to implement. I didn't mention, Madam Deputy Speaker, that we've introduced a school nutrition policy that is right now at the stage of being implemented with the good support of our partners in the Ministry of Education. And we're doing well in that regard as we seek to implement that. And I'm seeing changes in the way that our children embrace the concept of nutrition and good nutrition. But beyond that, the ministry is currently working on a national nutrition policy that will now govern nutrition across our island, not just at the level of our schools and our children. So there's significant work that's being done to drive this concept of good health forward. And as I close, I want to remind my people, my brothers and my sisters in Barbados, take your health seriously. There are many screening protocols that have been revised, enhanced, and introduced. We have screening protocols relative to prostate health, prostate cancer. We have protocols and screening protocols and guidelines relative to colorectal cancer. We have screening protocols that are on their way relative to breast cancer. And this will guide our physicians in knowing what to do and how to do it as a person comes to them seeking treatment in these regards. But I want to encourage the people of Barbados, early detection is important. Go get your annual checkups, get screened for everything under the sun, if you can, and ensure you can do these things. I mean, we have a mobile clinic. We have a mobile clinic that goes throughout communities where persons can be screened for the vast majority of NCDs within a mobile environment. Outside of that, you can walk into any polyclinic, get your diabetes, your sugar checked, get your blood pressure checked, get your cholesterol checked, free of cost. So, Madam Deputy Speaker, I support this resolution before the House. I support not only the resolution relative to the lease of lands to BACA, I support the housing development that is being established and tabled as well, the allocation of land to build 33 units. I support that fully as well, even as our hardworking Minister of Housing continues on his diligent pursuit and his ambitious program to house our people. It's not an easy job, because as a member of Parliament, I get the demands, Honourable Member for St. George South, I get the demands every day relative to housing. And I don't burden you with all of them, but I do burden you quite often, because we need to ensure that we can build some houses for the people. And I know that you're working on my behalf and the people on my behalf. I'm working through me to the people of St. Michael North, because I keep on agitating on their behalf so that they can have some housing solutions at their doorstep. And I know that work is being done in that regard. So I support, Madam Deputy Speaker. I want to encourage our people. This palliative care facility is a good move. It allows our people, even as our government continues to ground itself in the philosophy of making a better life for our people, it grounds itself in the philosophy of people first, being compassionate, and giving our people hope. And I therefore believe that this particular resolution relative to palliative care will give our people hope and allow us to be able to deliver excellent health care to the people of Barbados. Madam Deputy Speaker, I'm obliged to you.
Thank you very much, Madam Deputy Speaker. And I rise to lend my voice with my other colleagues who have risen to support the establishment of hospice and palliative care here in Barbados, as well as the housing initiative that also comes in the second bill. And I rise to speak on this because this is a critical part of our overall program of how we're going to care for our people, especially our seniors. This facility for the terminally ill has been needed for a very long time. Like all other MPs, I have been faced with families who have had to deal with the diagnosis of cancer or some other illness that is eating away and taking away the life of a loved one, and faced with the challenge of how to care for and to manage the loss as death keeps creeping closer and closer into their families. And this has caused so much anguish in our communities. Having one of the constituencies that probably has one of the highest percentages of persons who are above the age of 60, I know what the burden is on families. I've had one family that luckily they were in a position to be able to get round-the-clock care for end-of-life care for a dear loved one. They were able to bring a doctor who could administer the drugs to ease the pain and suffering as that person was on their way out and kept them comfortable. But I also have had other people in my constituency who could not afford that type of care. And families were burdened with the problem of how to make sure that that person is cared for all day, every day, all night. How to help ease the pain that the person was experiencing, the deprivation because the person could not help themselves, and the family could not provide all of the care that was needed. It is a painful and excruciating exercise. And therefore I want to salute the Barbados Association of Cancer Advocacy MACA for what they are doing. I am deeply grateful because I know what this is going to mean for people in end-of-life care. But I rise to particularly speak to the fact that this represents a model that we need as a country going forward in addressing many of the needs that we experience as a country. This model that is here before us in this particular paper, this bill, represents private sector, it represents the NGO community, it represents the diaspora, it represents government coming together to address a critical problem in our country. And to me, this model is an important model that we need to embrace in addressing these types of issues. I want to be able to congratulate them on presenting a holistic and well-rounded program as to how they're going to take care of the needs and the operation of this hospice. Because I believe that it is important that we are able to offer this care at a level of cost that is more affordable for the average Barbadian family. One of the things that I want to congratulate the Honourable Member for St. George South and indeed the Ministry of Health, because they will have a critical part to play in this, that this particular bill is going to facilitate as well government being able to contribute meaningfully to the support of this program, whether it is in relation to the medications, whether it's in relation to a subvention. This is a model that I believe can revolutionize what is happening for the terminally ill in our country. I therefore want to recommend as well that we need to take another step and to make a call into our community for others to step forward to be able to look at respite care. One of the major challenges that we face because of having an elderly population is the fact that there are many people who are caring for people who may not be at end of life and therefore do not qualify for palliative care, but they certainly need the support in order to help manage that family member that is disabled, that is bedridden, that is plagued by an illness, maybe an NCD or some other illness that prevents them from being a productive member of the society. And as a result, it means that someone has to pay attention to their everyday care. But what I have noted, Madam Deputy Speaker, is the toll of care on the caregivers. Many, many households have older women who are caring for maybe an elderly male patient, a husband who is ill, and vice versa, where a man, an elderly man, finds himself having to care for his wife or partner who is now ill and who can no longer function in the family as they used to. And I've seen the burden and the strain, the stress, the impact it has had on their own health, whether it has manifested itself in high blood pressure, whether it's manifested itself in stress-related illnesses. And one of the things that broke my heart was going to a home one day in my constituency where a woman was caring for both her mother, who was suffering with dementia, and her husband, who was suffering with Alzheimer's. And she could not get one single moment to herself. She could not get an hour, 2 hours to go to the bank. She could hardly find time to get to the supermarket. She could not go to take care of her own personal care needs. And she dare not spend too long resting because one of them would need care and were not in a position to make good decisions about what they were doing. And I'll never forget, as I talked with her, she shed tears. She said, "Sandra, I love them so much, but I am exhausted. I do not have any more that I can give. I don't dare ask someone to come in because in their mental state, they will become confused and agitated. That person does not know them. They do not know the house, and therefore they will not be able to care for them in the way that I know they need the care." And she could not get rest. And I can tell you, Madam Deputy Speaker, my concern was that she would pass away before the person she was caring for left this earth. And it was that experience that caused me to start taking note throughout my constituency as to the number of people who were in that position. And I recognize how important it is for our country to come to a place where we are going to be able to create respite care for these desperate families. Respite care would allow for that person to be taken to a facility to be taken care of for 2 or 3 weeks while someone went on holiday or got a rest. Respite care would allow for a well-trained person to come in and stay in the home and care for that person in need while the other person got a chance to refresh and recharge themselves. And it is going to be important that our country is able to get to a place where we could build another partnership similar to what we're building here with the Barbados Association of Cancer Advocacy, and come together, private sector, non-governmental organization, government, diaspora, working together to provide a facility that would provide the respite care that is absolutely necessary for this country. And Madam Deputy Speaker, it has to happen sooner rather than later. One of the things that we've discussed as a government, and we're not yet in a position to do it, but I know that is something that we would want to get to, that we have to reach a place where we can find a way to compensate those persons, whether they're parents or their children taking care of parents, to make sure that they get some kind of wage. In my constituency, there is a young woman caring for a father who is blind. And she has been unable to continue her pursuit of a career, her pursuit of education, because her entire day is taken up with the care of her father, and they have to live off of his pension. When he enters death, what is going to happen to her? She would not have had any skills. She would not have had any work experience. She would not have been able to accumulate assets or resources during the time of his illness to be able to take care of herself. She will then need someone to take care of her. And so we have to be able to work at the growth of this economy to bring it to a place where we can eventually look at providing a wage for those persons who do caregiving. Because if we were to do the economics around it, we would discover that it is in the interest of the country to pay that caregiver because the government does not have the funds to be able to build all of the facilities needed and give all the professional care. And if we can ensure that family members who provide that care are able to get an income, we would have better care for people who are in need and allow them to have care with dignity and free from abuse and free from neglect. With the Ministry of Training and Tertiary Education, we too have a responsibility in this space. One of the things, because we have an aging population, it is necessary that we're able to produce the necessary geriatric nurses that will be well trained to be able to deliver the care that needs to happen, not just within the geriatric facilities, but to be able to provide that care even at the community level. And BCC currently trains close to 16 nurses every year in geriatric nursing, but this is not enough. So one of the things that we want to be able to say to the public of Barbados is that we will be looking at ways in which we can expand this program and create a situation where we're training more geriatric nurses that they can help deliver the kind of care that is needed. And we will also be looking at the expansion of the nursing auxiliaries who help in terms of home help for our elderly and our seniors. But a glaring shortage that we have within this puzzle that we are building in order to care for people who are ill in our country, especially for our elderly, is that we have too few gerontologists. For a very long time, Barbados had only one gerontologist. In the last 2 years or so, another gerontologist has been trained, but these are not enough. We need to find a way that we can encourage more doctors to embrace gerontology so that we will have available to our elderly population sufficient persons who can give the kind of specialized care that we need for our elderly. And the last thing I will make advocacy for, Madam Deputy Speaker, the issue of the cost of care. I do not know how families manage who have an elderly or ill relative or disabled person that they are caring for, how they manage with the cost of care, the cost of supplies to take care of these persons. The cost of adult briefs is exceedingly high. $50 for a pack that will not last a week. The special nutrition drinks that our diabetics need to have, the individual cost of these items are too high for many families to be able to afford to give that person the balanced nutrition which they need. Now, Madam Deputy Speaker, I am not an advocate of price control. That's the truth. I know what price control did to this country when we put price controls on the basic food items in Barbados. It led to the death of small shops all across this nation. Why? Because small shops carry the basic items. They don't have the other items that the large supermarkets can jack up the prices on to help balance back their monies. And so small shops died when we did price controls on basic items. However, I would like that there be some sort of analysis on whether we can undertake to make control on the pricing of these essential care items for the elderly, for people who are disabled and who cannot not get them, to make sure that they stay affordable for our people, that we can give the kind of care to our seniors and give them a dignified life. Because, Madam Deputy Speaker, when it is not available, these things are stretched. and they're stretched in ways that do not redound to the health of our seniors. And in terms of the cost of care, I know one of the challenges with our senior citizens' homes is that many of our senior citizens' homes are not purpose-built, but the regulations stipulate how many persons can be in a space. And very often, it does not allow for sufficient seniors to make the nursing home viable. And so there's always a struggle. And where is the cutoff point? The cutoff in terms of how many professional nurses are available on at any particular time. The cut may be in the quality of the food. The cut may be in the level of activities provided for our seniors in these nursing homes. And therefore, one of the things that we have to plan for as a country is to look at how we are going to look at designing purpose-built care facilities of a sufficient size, and again, have a private-public partnership where we allow people in the community to be able to rent these spaces and deliver these services, and to be able to do it in a way that is profitable and at the same time meet the high quality standards of care in the facility for our seniors. So, Madam Deputy Speaker, I want to thank you very much for the time. I want to congratulate again the Barbados Association of Cancer Advocacy, BACA, for your excellent work in bringing this to fruition, and to the Honourable Member for St. George South for being able to facilitate such a program by the provision of these premises and facilities to allow for hospice and palliative care. I'm obliged to you, Madam Deputy.
Honourable Member for St. George.
Thank you, Madam Deputy Speaker. First, let me thank those members who contributed to this debate, this cognate debate. Firstly, to vest lands of the Coverley Great House into Baca, and thereafter lands to construct some 32 houses. And, you know, we should have no difficulty in supporting this resolution for Baca to build this hospice and palliative care facility. And as you heard from the opposition leader, he supported, but his difficulty was the location, and that's his right. He can oppose the location, but at least what we got today, the consensus among all members in this lower chamber, that indeed we need a facility such as this one that we indeed brought to this lower chamber to build out. I want to thank the Minister within the Minister of Health, within the Ministry of Health and Wellness, a member for St. Michael North, who spoke extensively on health care. He went wide, not only palliative care, but thank you for the elucidation and the explanations to the public on the good work that you are doing, member for St. Michael North. I also want to thank the member for St. Michael Northeast, who indeed is passionate, Southeast, sorry, who indeed is passionate about palliative care and the role that building out such facilities in this country, the benefit that it redound to not only poor people, but general public, because very often we talk about this value of the dollar and persons not being able to afford. And I said when I spoke earlier this morning that this palliative care facility is, while we recognize the importance of it for those persons who can't afford to have the support at home, it is a psychological benefit to all classes to have such a facility that persons can go, you know, to look at the whole spiritual good of it, the psychological good of it, and indeed the physical space and recreation as well. I heard the member for St. Michael North mention not only do persons go to these facilities for care, but indeed the aftercare, the recreational aspect of it is therapeutic, and it deals with the mental wellness. So we have no divide in this chamber, and I want to congratulate BACA for the efforts. And indeed, it will be a new facility and not a refurbished facility. And the lease, the honorable member for Christchurch South, the lease is $1,000 per annum. And I just want to make that clear. While he would want to debate who got free lands and who didn't get free lands, it is the government, right? We create policy, we create rules by which we lease lands, and the lease tobacco is $1,000 per annum. Now, Madam Deputy Speaker, let me move to housing, because the honorable member is seeking to create some mischief. Well, he sought to create some mischief this morning with respect to the role that national housing is playing as it relates to housing in this country. And this venture that we will enter in at Coverley is no different to what we're doing at Atlantic Breeze. It is no different to what we'll be doing at Vineyard. We will be building some 600 houses through a joint venture partner who shall remain nameless until we sign that agreement. But I will say within a week or two, we will sign an agreement to build 600 houses at Vineyard. And it's no different to what we're doing at Brighton, where we're building some 42 houses in a joint venture partnership. And National Housing Corporation is not excluded from these partnerships. The land vested in National Housing, and National Housing manages its joint venture partnerships with these various private sector entities. And that's the role. National Housing also pre-qualify persons who apply for mortgages, because National Housing has within its arsenal over 18,000 applicants. So to come to this Lord Chamber and to give the public and the members in this chamber that National Housing has been excluded from the work that will be done in the joint venture partnership is indeed misleading. National Housing, we vest the land in National Housing, the joint venture partners bring the capital, some of them build the infrastructure, then they build the houses, and I said earlier, the whole process of a mortgage application is to ensure that we do not utilize the consolidated fund and we utilize the liquidity within the banking sector. There's nothing new to that. But again, the member for Christchurch South sought to create mischief to say that National Housing is excluded. But National Housing is the joint venture partner for the project that will see the construction of 33 houses. And he said units. I mean, he's playing with words, semantics, 33 units, 33 houses. I guess he didn't have much to say with respect to the project. But I just want the Lord Chamber to understand that under the last administration, 158 lots were sold at peppercorn rate on the said Coverley estate by the then Democratic Labour Party. 158 lots and a few commercial spaces, and they were sold at peppercorn rate. So to say we are taking up agricultural land again to build houses, I mean, he comes to this chamber, he keeps making this statement, and I guess by now, the general public who needs houses in this country will understand that it is a red herring. He has nothing to contribute in housing. It is not law, and he's at a loss when he speaks on housing. And I say to the honorable member, and I say to the public, this housing program will not stop. It will carry on. This is the government's mandate to house every last person and to see how many houses we can build to reach our 2,000 target annually. We came to the government. Yes, we made a throne speech where we said we'll build 10,000 houses. It's a stretch target. And I keep saying to persons, we are pushing to see how many houses we can build. In a year, last year, we managed between the year 2022 and 2025, the financial year, we managed over 1,600 houses. We are pushing this year, this financial year, to build 1,500 houses, or as close as possible we can get the 1,500 houses. The honorable member for St. Michael South, he spoke to her Lower Burnie project, and I'm pleased to report that we have finished the designs, the road designs at Lower Burney, and we are going out to tender in a week or two. And we should see some work started in the second quarter of this financial year with respect to the road infrastructure. And by the third quarter, we intend to see some houses going up at Lower Burney to address some of the challenges that the Honourable Member for St. Michael Southeast face. And she has tapped the desk because indeed this is a project that is dear to our hearts, the government, and also not only to the member for St. Michael Southeast, the people of the Pine, the people in the surrounding districts of Dash Valley, Haggett Hall, Cotton Road. Those are persons who will benefit from this housing project that will see close to 400 houses being constructed at Lower Burney. Mr. Speaker, Madam Deputy Speaker, I want to end by saying that hope is the building entity for government. We've just signed a contract with Jorvilla out of Guyana to build in a turnkey project 89 houses at Dawes North. Currently, the infrastructure works at Branchbury and St. Joseph will start next month to build some 68 houses. And government will enter into a contract with Jorvilla to provide 500 houses to this country. Now, if the Honourable Member wants to come to this chamber every time we have a housing resolution to say that hope needs to be shut down, then he doesn't understand the whole aspect of moving from an artisanal approach to building to an industrial approach. The more houses you can build on a piece of land gives you something called economies of scale so that we can drive the cost of housing down. That's why there are some developers who would tell you that they don't want to build 40 houses, they would like to build 200 houses on a plot of land. 33 houses on a 4.5 acre plot is a small housing project. I heard the Honourable Member saying it's a lot of land. Now clearly the Honourable Member, he doesn't understand building. To say that 4.5 acres for a housing project is a lot of land, he's totally out to sea as it relates to housing, and I expect that. I expect that. National Housing Corporation is an entity we know back in the 60s, 70s, 80s, and 90s, and 2000s, early 2000s. National Housing was the building entity for government. But National Housing did not achieve the efficiencies or drive the cost of building down. And the statistics are there to show that under the last administration, houses were built at over $600 a square foot. Now we are building at less than $350 a square foot, which is close to half and even lower, because the price of houses at $146 a square foot with minimum subsidies is testimony to how the government viewed this housing program. And I'm also to report here this afternoon that at Vesper Garden, that came under so much criticism by this opposition and the member for Christchurch South, out of the 148 houses, 127 persons have received keys out of 148 houses that were built. And the other 27 persons are going through the legal process to receive their keys. And shortly, we'll be going to St. Thomas, Honourable Deputy Speaker, where we will be starting the infrastructure to construct some 40-something houses over at Allen View. So the Honourable Member, he can continue, the Honourable Member for Christchurch South, he can continue to come to this chamber and try to give the public the impression that we're indeed twiddling our thumbs and we're not focusing on efficiencies within the housing program. And I say to him, we intend to house every last person, whether it is over the next 3 years, 5 years, or 7 years. But this government intends to drive down those applicants, those applications that were lodged in NHC for eons, some over 20 years, some over 30 years. And indeed, persons are seeing the progress. We just went to Clifton, and we opened a small housing development with 11 houses. And soon, we'll be going to Bullins in St. James to open that housing unit as well, where we are building some 36 units under the East-West program. And these units, indeed, they're oversubscribed. We have 36 units and over 100 applicants waiting for these units. And indeed, that speaks to the demand for housing in this country. And Madam Deputy Speaker, my role is not only to provide housing, but indeed to vest lands for tourism, vest lands for healthcare, vest lands for sports, vest lands for road construction. And that is the duty of the Ministry of Housing. And with those few words, Madam Deputy Speaker, I beg that these two resolutions down in a cognate debate, one at a time. Thank you. Madam Deputy Speaker, I beg that the resolution to vest, I'll speak to the first one, the resolution to lease of the site of Coverley Warehouse, approximately 7,922.5 square meters at Coverley, Christchurch, to facilitate the establishment of a hospice and palliative care facility for the Terminal Hill. I beg that this resolution now pass.
Honourable members, the question is that this resolution now pass. Honourable members in favour, please say aye.
Aye.
Those against, please say no. I think the ayes have it. Ayes don't.
Order number 10, in the name of the Honourable Leader and the name of the Honourable Minister for Housing and Lands, to move the passing of the resolution to approve in accordance with Section 5 of the Crown Lands Vest and Disposal Act, Chapter 225, the lease to the Barbados Association for Cancer Advisory, the ACA, of property situated at Coverley in the parish of Christchurch in this island, more particularly described in the schedule here, to facilitate the establishment of a hospice and palliative care facility for the terminally ill, the terms and conditions stated in the second schedule there. Just move that fast.
Madam Deputy Speaker, I beg to move that resolution number 10 now pass.
The question is that resolution number 10 do not pass. All honourable members in favour, please say aye. Aye. Those against, please say no. We think the ayes have it. Resolution 10 now stands.
Madam Deputy Speaker, I beg to move the passing of a resolution. So both of them finished? Madam Deputy Speaker, I beg to move that the resolution to allocate lands at Coverley for the development of 33 residential lots and to vest these lots at measuring 18,245.6 square meters in National Housing Corporation do now pass.
Question is that this resolution do not pass. All other members in favor, please say aye. Aye. Those against, please say no. We think the ayes have it. Resolution now stands passed.
Order number 3. Order number 3, Madam Deputy Speaker. Order number 3, in the name of the Honourable Minister of State in the Ministry of Health, to move the second reading of the Health Services Medical Report Fees Validation Bill 2024.
One second.
Member for St. Michael North.
Thank you, Madam Deputy Speaker. A very simple, straightforward bill before the House, the Health Services Medical Reports Fees Validation Bill. Madam Deputy Speaker, during the course of a health professional's daily activities outside of the clinical services that they provide, there are occasions where they are required to prepare medical reports. Medical reports can be for insurance purposes, it can be for instances where there are accidents. Medical reports can be required by employers. There are many different reasons why a medical report may be required. But medical reports, by their very nature, are very comprehensive and very exhaustive documents. They require that medical professional and even paramedical professional to be able to do extensive history on that particular individual. And in many cases, it requires a heavy amount of due diligence in looking at the person's record from the Queen Elizabeth Hospital and other places as well. What we've had over the years, Madam Deputy Speaker, is a situation where the Queen Elizabeth Hospital and its various professionals, whether the medical practitioners or the paramedical practitioners, have been able to charge for the delivery of medical reports. That charge, as it currently stands, is $375, Madam Deputy Speaker. Where $150 as a portion of that $375 goes to the physician or to the paramedical professional, and the rest of it, $225, goes to the state for obviously the work that goes into pulling those records, etc. Unfortunately, when a person goes to the polyclinic, another state-owned enterprise, state-owned institution would be better or more suitable in this context, and they receive that same level of care from a medical practitioner and a professional. They are not charged the $375 as is the case at the Queen Elizabeth Hospital. So, what we are seeking to do here is to simply regularize the environment, given the fact that there's a significant amount of work that is done by all professionals across the board, whether at the Queen Elizabeth Hospital or anywhere else, to be able to deliver a medical report to our citizens. We are now seeking to validate and regularize the environment so that within the polyclinic setting or within the Queen Elizabeth Hospital setting, there is a regularity that says that there will be this charge of $375 for the delivery of a medical report to individuals. As I said, Madam Speaker, just to emphasize, of that $375, which is already an established fee, there's no increase to the fee here. This is not a case where we're increasing anything that is already established. The $375, as it currently stands, $150 of that goes towards the medical professional or the paramedical professional themselves. So that could be a physiotherapist, for example, speech therapist, that may be the person that is delivering the medical report. Of course, it could be your medical doctor. Any of those range of persons, medical or paramedical, $150 goes to them, and the other $225 goes to the state. And that will be an arrangement that continues with this passage of this bill and the regulations that will accompany it. So with those few words, Madam Deputy Speaker, I beg to move that this bill be read a second time.
Can I second that?
All members, the question is that this bill be now read the second time. All our members in favor, please say aye. Those against, please say no. We think the ayes have it.
Madam Deputy Speaker, I beg to move that you do now leave the chair and the House resolve itself into committee for further consideration of this bill.
The question is that I do now leave the chair and the House goes into committee. All honourable members in favour, please say aye. Those against, please say no. Me think the ayes have it.
This honorable House is now in committee.
Mr. Chairman, sir, I beg to move an amendment to Clause 1 to state the year 2025. With that, I beg to move that Clause 1 will stand par as amended.
The question is that Clause 1 stand part as amended. All honorable members in favor, say aye. Honorable members against, say no. Methinks the ayes have it.
Mr. Chair, I beg to move that Clause 2 stand par.
The question is that Clause 2 stand part. All honorable members in favor, say aye. Honorable members against, say no. Methinks the ayes have it.
Mr. Chairman, I beg to move that you now report the passage of one bill in committee.
The question is that I do now report the passage of one bill in committee to Her Honor, the Deputy Speaker. All honorable members in favor, say aye. All honorable members against, say no. Methinks the ayes have it.
Honourable members, the chairman of committee has reported to me the passing of one bill in committee.
Madam Deputy Speaker, I beg to move that this bill be read a third time.
The question is that this bill is now read the third time. All those honourable members in favour, please say aye. Those against, please say no. We think the ayes have it.
Madam Deputy Speaker, I beg to move that this bill be now passed and cited as the Health Services Medical Reports Fees Validation Bill 2025. Act 2025, sorry.
The question is that this bill be now passed and so cited. All honourable members in favour, please say aye. Those against, please say no. We think the ayes have it. This bill is now passed and so cited.
Thank you, Madam Deputy Speaker. With that, we've come to the end of today's sitting. I therefore beg to move the adjournment of the House until Tuesday, the 24th of June at 10 a.m.
The question is that this honourable chamber be adjourned until Tuesday, the 24th of June, 2025 at 10 in the morning. All our members in favour, please say aye. Those against, please say no. You think the ayes have it. This chamber now stands adjourned.